Thank you so much, Professor Ogoina, for your leadership of the Emergency Committee over the past year and for your ongoing commitment to the fight against Mpox in Africa. Thank you so much. Of course, Mpox is only one of many health threats in the Democratic Republic of the Congo. Yesterday, the government of the DRC declared an outbreak of Ebola virus disease in the central province of Kasai. So far, 28 suspected cases and 16 deaths have been reported, including 4 health workers. WHO already has staff on the ground in Kasai, with more on the way. We're joining rapid response teams to trace contacts and find cases. We're collecting and testing samples, and we're providing technical expertise in surveillance, infection prevention and control, treatment, risk communication, and more. WHO has also delivered personal protective equipment, laboratory equipment, medical supplies, and a mobile lab. We had previously prepositioned 2,000 doses of Ebola vaccine in Kinshasa, which we're releasing to vaccinate contacts and health workers. This is the 16th outbreak of Ebola in the DRC, and the government has rich experience from those previous outbreaks. I thank the government for its leadership in responding to this outbreak and for its transparency in rapidly declaring the outbreak and sharing the viral sequence. To fund the response, WHO has released $500,000 from our contingency fund for emergencies, and we appeal to donors to support the response. Now to Gaza. Over the past week, parts of Gaza have come under heavy bombardment as part of Israel's military incursion. If this continues, it could lead to an even worse humanitarian disaster, endangering water and sanitation facilities for nearly 1 million people, many of whom are already facing extreme food deprivation. As you know, famine was declared in parts of Gaza 2 weeks ago. Since the conflict began in October 2023, at least 370 people have died from malnutrition in Gaza, including more than 300 just in the past 2 months. And where hunger goes, disease follows. Lack of food and clean water and cramped living conditions are leaving people with weakened immune systems exposed to more disease. In the past months, more than 100 cases of Guillain-Barré syndrome have been reported, with 11 deaths, a syndrome that can occur after other infection and lead to paralysis. WHO is doing the best we can to alleviate suffering and evacuate those who need urgent medical care outside Gaza. Since October 2023, WHO has supported the evacuation of over 7,640 patients, including 5,300 children and 2,660 companions. But there are still more than 15,000 patients in Gaza who need urgent specialized care, including 3,800 children. More than 700 people have died while waiting for medical evacuation, including almost 140 children. However, the urgent problem we face is that too few countries are willing to receive them. We call for countries to open their arms to these critically ill patients. And we call on Israel to allow people to be treated in the West Bank and East Jerusalem, where hospitals closer to home can take many patients. Above all, we call on the government of Israel to end this inhumane war. If it will not, I call on its allies to use their influence to stop it. The most intolerable part of this man-made disaster is that it could be stopped right now. People are starving to death while the food that could save them sits on tracks a short distance away. And for what? The starvation of the people of Gaza will not make Israel safer, nor will it facilitate the release of the hostages. This is a catastrophe that Israel could have prevented and could stop at any time. Starvation of civilians as a method of war is a war crime that can never be tolerated. Doing so in one conflict risks legitimizing its use in future conflicts. While the wars in Gaza and Ukraine continue to make headlines, the war in Sudan continues to be the war the world forgot. Like Gaza, Sudan is also facing a hunger crisis with famine conditions confirmed in parts of the country. This year alone, over 770,000 children are expected to suffer from severe acute malnutrition. WHO is supporting 142 centers that have treated more than 20,000 severely malnourished children so far this year. At the same time, the country is facing a severe cholera outbreak, which has spread to all 18 states with more than 105,000 cases and 2,600 deaths. In August, WHO supported vaccination campaigns that reached 3.5 million people. And we will soon launch another campaign targeting almost 2 million people in Darfur. Since November 2023, over 17 million people have been reached with oral cholera vaccines. The situation is especially severe in the region of North Darfur, where the city of El Fasher has been under siege for more than 500 days. More than 260,000 people need urgent health assistance. 35 health facilities have been destroyed. There are 5,000 suspected cholera cases and 98 deaths. 130,000 children are suffering from malnutrition. And survivors of sexual and gender-based violence need urgent care, including mental health support. UN humanitarian aid, including WHO supplies, hasn't reached the city in over a year. We call for the immediate opening of safe and unimpeded humanitarian access to El Fasher to meet the mounting health needs and save lives. We call on the RSF to lift the siege, and we call on all parties to the conflict to end the war. Finally, today, WHO is releasing the latest editions of the WHO model lists of essential medicines and essential medicines for children. These lists are among WHO's most important products, used in over 150 countries to shape public sector procurement, the supply of medicines, health insurance, and reimbursement schemes. The updated lists include new treatments for various types of cancer and for diabetes with associated conditions such as obesity. Medicines for cystic fibrosis, psoriasis, hemophilia, and blood-related disorders are among the other conditions. And finally, today is the last press conference for WHO's Director of Communications, our friend and colleague, Gabriela Stern, who is retiring after more than 6 years at WHO. Gabi has led WHO's communications through an incredible period in the organization's history, including the COVID-19 pandemic. She has done so with incredible dedication, energy, insight, empathy, and experience. Gabi, thank you so much for everything you have done and for who you are. Thank you for your outstanding commitment and contribution to WHO. And more importantly, to the people we serve. We will miss you, and we wish you every success for the next chapter of your life and career. Christian, back to you.
Well, thank you very much, Dr. Tedros. Thank you, Professor Boyna, and thank you, Gabi. Yeah, with this, we open the floor for questions. Please, again, raise your hand with the raise your hand icon and unmute yourself when it's your time to speak. I'll try to see if we can get one question through to Rick Pippercorn. I was told he might have to leave, but let me see if he's still online. So we have one question from the colleagues of BBC. Doctors in Gaza are talking about the spread of an undiagnosed virus. What do we know about it? What are the symptoms? How dangerous is it? Over to you, Rick.
Yes. Yeah, just coming back in, from Gaza last Monday, I was there again for more than 2 weeks. There's definitely an increase in acute respiratory infections, but we, I think, are constantly reporting on